Well, good morning. Good morning. Welcome to our very first GGRA Luncheon online, everybody. My name is Lorenzo Lewis, and I am the newly appointed president of GGRA. And I never thought that when I was voted in a month ago, that I would start my term in this fashion. I'm telling you. And I'm sure that we all didn't realize that for a time that we're in right now, that this would be our new normal for conducting business, I tell you. But one thing I do know is that we've all have tapped into our unknown creative talents, right? I tell you, I want to welcome you all to this virtual luncheon. I hold up my symbolic sandwich for this occasion. But before I get started, I really want to acknowledge all those who make GGRA exactly what it is. And I want to start off with acknowledging our former president, Miss Rachel Ordell. Thank you so much, Rachel, for everything that you've done up until this point, and then being there for me as I transition into this role here. Thank you so much for all that you do. Thank you. And then also,
you're welcome while I'm chewing on pizza here.
Amen. Thank you so much. And now I just want to acknowledge my vice president, Brandon Spar, has man, he has been a godsend to me. My treasurer, Taylor Davis, our secretary, Antoinette Fields. I want to also thank everyone. I don't want to take up too much time, but I want to acknowledge just everyone that's on our advisory board. Thank you guys so much for every single thing that you have done and continue to do. So now I just want to go into our announcements. We want to keep everything going swiftly so that we will not go over the hour that we have allotted. I want to make sure that we are very cognizant of your time, and we want to respect your time. So going into our announcements for, this time right now. Now, I know we were going to have a resource fair, and we were going to have that this April, but as you know, the governor has came on and said that everything that we do for April is pretty much have just been eliminated. So there's nothing that is scheduled for us to do in the month of April. Now, as far as the resource fair that we were going to have, what we're going to do is we're going to move that back to July. And we're going to have that in conjunction with Reentry Awareness Month. So we're going to do that all in July. And then I want to let you guys know that our next virtual luncheon will be on May 5th, just like we're doing it right now, on May 5th from noon to 1. So mark your calendars for that. And then for all services updates that you may want, go to our website at GwinnettReentry.org. And then also anyone that wants to post any of your updates on our website, email us at info@GwinnettReentry.org. That is info@GwinnettReentry.org. And so at this time, I am going to turn it over to Brendan. He's going to talk a little bit about what's going on with the SB 288. Brendan.
Thanks, Lorenzo. So the Second Chance campaign was in full effect. You guys, if you were at our March meeting, you heard about the Senate Bill 288, the Second Chance bill. And what that bill would do is to allow people to have a second chance to get their records restricted, more people than ever before. Right now, you can only get your record restricted if it didn't lead to an arrest. It didn't lead to a conviction, I'm sorry. If the arrest was only an arrest and it was diverted or first offender or basically went away, you could get that expunged. Well, that really doesn't do a whole lot of good for a lot of people. So Senate Bill 288 would expand that to include all misdemeanors. What you could do is go before a judge and petition to have your record restricted from public view, from the view of employers and housing, after a period of 4 years has passed from the conviction date or your off-paper date for the misdemeanor. So after 4 years of keeping your nose clean, you can go back to the judge and petition to have your record restricted. Now, what about felonies? Everybody's asking. Felony convictions do apply as long as they're not serious, violent, or sexual offenses. And what you would have to do in that case is get the pardon. Once you've been pardoned by the Pardons and Parole Board, you can then go to the judge that sentenced you and petition to have your records sealed as well. So all misdemeanors, as long as they're not serious, violent, or sexual in nature. And then felonies the same way. But the felony, the caveat is you have to go and get pardoned first. Now, anyone under the old rules of diversion or anything like that, that still applies. If it didn't lead to a conviction, you still can have it restricted right away. But now this opens it up to people with certain felonies and most misdemeanors. But you do have to go before the judge and make your case, and they have to say that the public's right to know doesn't outweigh your right to be restricted. What was really cool about this, it happened right before the crossover day, which is the last day that anything can happen in the Senate or the House. This actually made it through crossover on the last day. And then everything shut down, so we're waiting on the House to pick it up and run with it. It was unanimously voted in the positive, so every senator voted yes, this should happen, which is great. And really cool, Senator Unterman, our senator from Lawrenceville, she actually got up and said a good thing about GRIP and the reentry programs that Gwinnett County has. So I'm going to let you hear from Senator Unterman. It's about a 2-minute video of her remarks from the Senate floor last month. Here's Senator Unterman.
Thank you, Mr. President. Members of the Senate, I appreciate the Senator bringing forth Senate Bill 288, and I rise in favor of this bill and also in favor of the amendment. And the reason I'm here is because it's kind of sentimental. Y'all know I'm leaving, and kind of words of wisdom that I'm trying to bestow upon you. But for the past couple of years, Gwinnett County was very fortunate to receive the first federal grant about the Georgia Reentry Program. And I just want to encourage you in your individual counties that some of your counties do have these reentry programs set up and moving forward. Some of the counties, because I've talked to some of the senators, do not even have these existing programs. And I want you to encourage with your state government, as federal, state, and local government, to work with your local folks, your local elected representatives, your board of commissioners in these reentry programs. I go to the meetings at least quarterly, and I can tell you how fulfilling it is to go to the meetings and to see these different levels of government working with these reentry programs, and they are absolutely phenomenal. And when you go to your local correction facility and you see the people in that facility going through their programs, it is amazing work that we're doing. And it all started out with former Governor Deal on the reentry program. But I encourage you to ask your Board of Commissioners, why don't you have this program, and why don't you help fund it with the state of Georgia? Because these people get a second opportunity, a second chance. And it is so fulfilling as a state senator to go and see the volume of people that you're helping, and the success rate is phenomenal. So I encourage you to look up the Georgia Reentry Program in your individual county, and I yield the well. Thank you very much.
All right, Lorenzo, back to you.
Wow, that was awesome and very encouraging. I tell you, as someone such as myself that has been affected by incarceration, I tell you, those things are wonderful to hear. So we just keep moving forward. We keep pushing behind these type of things that are going on in our courts, and I'm sure that we will see some wonderful strides going forward. But at this time, I would like to bring up Miss Amy R. She's over Motherhood Beyond Bars and have a wonderful initiative and awesome resources to share with us. So, Miss Amy, are you here?
I am.
I think I'm unmuted. If you can you hear me? And now
Yes,
my
ma'am,
phone's
I can
ringing.
hear you. Over to you.
Great. Well, I am thrilled to be in the way that we are all being these days with all of you. I was looking forward to attending my first in-person Gwinnett Reentry Alliance meeting, but here we are. And really pleased to be able to tell you a little bit about Motherhood Beyond Bars and the work that we're doing currently. I also know that Elaine Ellerby is on the call, and she is also working with me at Motherhood Beyond Bars. Just brings a wealth of information from her years in Louisiana working on parenting programs. Motherhood Beyond Bars has been around about 6 years, started at the Emory School of Public Health. And for many years, we worked and were the only nonprofit organization in Georgia working inside prisons directly in the state of Georgia with pregnant women and new mothers. So we ran 4 weekly programs that included childbirth education, weekly yoga, a postpartum support group at Lee Arundel State Prison, and monthly baby showers. And 2020 was always the year that we were hoping to expand our services outside of the prisons. And that's a good thing because now there are no volunteer organizations or outside educational organizations even going into GDC facilities. So all of our inside programs are kind of on an infinite hold. It feels like an infinite hold. But that allowed us the time and the space to do programs that we had already planned on starting. And there are 2 that I want to bring to your attention. One is a caregiver support program. And just before we all headed home for a long stay at home, we received a generous grant from a family foundation to provide real concrete, tangible supplies to caregivers who were taking temporary custody of a child whose mother or father was in jail or prison. And although we intended to work directly with the hospitals where babies are born, all babies are born in the same hospital if the mother is in state custody. For obvious reasons, we're not going into hospitals and providing that care now. So we have a decent amount of money to provide diapers, wipes, and formula to any caregiver family that has a young child in their care. And one of the challenges that we have is making sure that caregiver families find out about this help. So to date, we've sent out about $500, $600 worth of diapers and wipes and formula, although we know that the need is greater than that, and we have the money to spend on this program. So I would ask for your help in spreading the word to the organizations that you're affiliated with. Our focus is on Georgia, but we are willing to expand Southeast, nationwide. As long as the money holds, we will be here. We really don't want to encourage these, what are often the maternal grandmother of the child, to be going to diaper banks and that sort of thing in this time period. So almost everything we've done to this point has been shipping from Amazon, Walmart, Target, directly to the caregiver's home. So that encourages them to stay put and not put themselves in greater risk by going to a diaper bank. And the second program that we are excited to be launching in 2020 is reentry support, specifically for mothers who are coming back to their families. There are so many wonderful reentry programs in Georgia, around the country, but as we've looked around, family integration has not always been, and for some obvious reasons, a real focus of those programs. Housing, jobs are absolutely important, but we started looking around for programs that helped families reunify and didn't find a lot of programs out there. So this is giving us the time and the space to develop some programs that once a mother has safe housing and is able to get her feet back on the ground, really to help talk about how you reunify that family, how mothers have hard conversations with their children about where they went. And we really want to have the entire life cycle covered. So if we can get doing the education, self-advocacy work while women are pregnant, through the course of their birth, postpartum, and then are there on the other side to help them figure out how to be in that family unit again. That's our eventual goal. So thank you all for the work that you do. Please help spread the word about kind of the immediate needs that we can try to help fill for some of these caregiver families. And we are also very, very happy to send out those same supplies to any returning citizen, mother, father, anybody coming back to their families as well. So thank you very much for the opportunity to tell you about our work, and thank you for all the work that you each do.
Wow, that is awesome. Thank you guys so much. This is definitely something that is much needed. So everybody that is within the sound of my voice, please rally around Motherhood Beyond Bars, because this is something that could be a godsend. It is actually a godsend to all those that are in need. And like she said, we don't want the grandmothers to be having to go to these diaper barns and things like that. We need to ease, the burden on them and help them with any resources that we can. So please rally around this organization, everybody.
And I didn't give you contact information. We have a website, motherhoodbeyond.org. You can contact us directly from that website. You can also, and I will put this information in the chat screen, but my email is info@motherhoodbeyond.org. That comes directly to me, and you can also reach us from our website, Facebook page as well. And once we hear from folks that are in need of those services, we make direct contact by phone. We usually help fill out a form together and then get those items sent out as soon as possible. We haven't had too many supply issues. Formula, especially toddler formula, is a little hard to find right now, but all of the diapers we've been able to get out in the same day that we got the request.
Wow, and thank you. And so if anybody has any information on formula supply, please reach out to them and let them know, partner with them so we can take care of the needs of our community. Thank you again so much, Amy. Appreciate you.
Thank you.
All right, so now at this time, what we want to do is we want to go into the announcements for all our wonderful reentry organizations and partners. You guys out here that's really partnering with us and helping us tackle reentry, addiction, everything that is definitely a plague on our community. You guys are helping to stamp out. So we want to give a couple of organizations a chance to give us some updates on what's going on and any resources updates or even some restrictions to what was recently offered that is no longer offered. Whatever it is, we want to hear from some of our key organizations. So we wanted to start off with Inspire. I don't know if do we have anyone from Inspire on with us today? Okay, so
it doesn't appear that we do, Lorenzo. I can give a quick announcement. I have been in contact with Greg Kennard, the executive director of Inspire. He says that they are working very diligently and very hard to keep the programming in place over there. And the guys are still actively participating in the programming. They have stopped intake, though, as long as the governor's stay-at-home order is in effect. So they will not be doing intake over at Inspire until further notice.
Okay. Do we have someone? Is someone from Inspire coming on?
I don't see anyone in the chat, and I don't recognize anyone in the participant list. So I think that'll serve as their update. Okay.
So then next, we want to bring up Salvation Army, Miss Debbie Wingrove. Are you there, Debbie?
Integrity is doing the right thing for the right reasons. If you've been injured or member here today, you treat your dignity and respect. We are not.
Miss Debbie, are you there?
She made it on either. I don't see her name in the participant list. And Debbie, if you are there, please say something in the chat and we'll get to you.
All right, well then we'll if she comes on a little later, we'll give her a chance to speak. But we're gonna move right along, and we are going to bring up Miss Antoinette from Veterans Resource Center to give us an update on what's going on over there. Antoinette?
Hi, good morning, everybody. Afternoon. So currently the Gwinnett County Veterans Resource Center, the offices are closed, but they are servicing veterans via phone. If you call 678-226 9177, and that is their general line. That phone will roll over to the director's phone, Danny Pagan, and he is picking up any messages off of that phone and servicing it, you know, as best he could via phone. And they are occasionally, you know, they have things there if you need to drop off paperwork or anything. They do have a system in place. So you can call that number. That number again is 678-226-9177. Also for Hope Atlanta, for veterans who are seeking services through the Support Services for Veterans program. We should be starting to do phone intakes and assessments starting on April 15th. Veterans can call our intake line at 404-574-1681. And you can get on the waiting list, and the case managers will be calling you back to start assessments if you're looking for housing services or services under the Support Services for Veterans program. For non-veterans who are seeking housing and other resources underneath the Hope Atlanta umbrella, they can call 404-817-7070, or, which may be best for you, to send an email to info@hopeatlanta.org describing what your need is, and someone will be able to get back to you.
Can't open the door for you right now. You haven't done your school.
Lastly, if you know of anyone who is looking for some type of employment services, the Goodwill, they have daily drop-in sessions. And these sessions are at 11 a.m. to 12 and 2 p.m. to 3 for the entire month of April. And this is Goodwill of North Georgia. I'm pretty sure you can go onto their site and see the link for those drop-in sessions, but we'll also post it. And during those drop-in sessions, it's basically a virtual career service. They're doing virtual career servicing. You can make appointments to have a one-on-one with a career counselor virtually. If you need help with resume or job search or whatever your need is surrounding job search and career, you can get that information and get help if you get into one of those drop-in sessions. They're happening for the month of April daily from 11 a.m. to 12 p.m. and 2 p.m. to 3 p.m. And that's it.
All right, I think we've got Debbie Wingrove from the Salvation Army now. Debbie, are you there?
Oh, great.
Yes, can you hear me?
Yes, we can.
Okay, great.
Go ahead.
Okay, the Salvation Army of Gwinnett is up and running through telecommunications. Our appointment line is still open and referring needs to our case manager, so those can be addressed for folks. And that number is 770-724-1661. Community partners can also send me directly an email if there's a crisis situation that you've assessed and you'd like the Salvation Army to give it some priority attention, and we'll be glad to do that. You can just use my email address, which is available online at the Salvation Army website. I can give it to you now, but it is the world's longest email, so it might be better to get it off the website. So what we are doing is we are trying to meet the needs as they come to our attention. It's been kind of a cascading, rolling situation. The first dramatic uptick in needs were for food and homelessness services. So we are trying to make sure that folks have emergency food and that folks are able to get off the street into some decent shelter during the pandemic. The courts are closed until May, I believe, 14th. And so there are no evictions being processed right now. Landlords are able to go online and file for the evictions. So May 14th, we'll have to decide as a community what we can do for folks who will be in that backlog at that time. Many of the utility companies are giving grace to their customers and not disconnecting. For those who are disconnecting, you can refer them to us. We do have still our homelessness prevention services to help with rental assistance, mortgage assistance, and utility assistance as needed. But right now we're really concentrating on emergency food services and homelessness services so that folks are inside during this pandemic and are able to safely shelter in place. So we're doing that by telecommunications, and that's been working pretty well for us. We are connected with the Gwinnett Helpline, with Home First, and we're getting referrals that way. And of course, our appointment line is still up and running and being monitored. And you can also contact me through my email if you're not able to get through one of those gateways.
Could you give the phone number again, Debbie?
The appointment phone number is 770-724-1661.
All right. Well, thank you, Debbie, again for that. That was some very valuable pieces of information. Thank you so much for everything that you guys do over there at the Salvation Army. Much needed. Thank you. Next, we want to bring up a viewpoint. Danielle, are you on? Danielle Mayberry, are you on?
Yeah, I don't see Danielle in the participant list unless she called in. Let me check these two phones right here.
Okay, I know she registered. Okay, so then we'll go on while we're waiting to hear from Danielle. So next up, I want to bring up Navigate Recovery. Amanda or Blake, are you there?
Hey, I'm here. Hey, everybody.
Amanda, how are you?
Good. How are you guys doing?
Wonderful, wonderful. So you go ahead and please just give us some wonderful information on what's going on with Navigate.
Sure. So for Navigate Recovery, we are all working remotely. As most of you probably know, we have two sort of departments. One is the ED department where we meet people bedside at the ED when we get a call, emergency department, if they have overdosed or at a high risk and they want to talk to somebody about recovery. As you know, we can't go into the hospitals right now, but what we are doing is the nurses and the staff are still calling us, and we are just making contact through the phone or virtual recovery coach sessions. We're keeping up with what resources are available if someone is looking, because it's changing daily, you know, where people are not taking anyone, or they can't, or they're on a hold, or they're full. So part of what Navigate Recovery is doing right now is a lot of meetings, a lot of recovery coach sessions, and just daily checking in on those resources to let our peers who are looking for connection or, you know, detox, whatever they need, and kind of keeping that posted. So we've been doing that. That's basically what we're doing, a lot of virtual stuff right now. So on our website, we do 2 meetings a day. We also have listed all meetings that we know about in the areas or anywhere around that would be beneficial to our peers who need recovery right now, because connection is very, very, very important when you are in recovery, especially being isolated. This is really tough for a lot of our peers. So we are just trying to maintain meetings, our own and outside meetings, on our website. It'll give you all the information about that, as well as on Facebook and that type of thing. So that's what we're doing right now to stay connected the best we can with our peers.
Oh, that's awesome. In your estimation, Amanda, what effects have this had on things going on over there, as far as not being able to go in and you know, be face to face with the people? I know that's a big part of what you guys do. Hold on.
Hang on a second.
Okay. All right.
Okay.
Sorry, Amanda, you were muted. Go ahead.
I think she's muted herself.
Oh, did she?
Yeah, I'm hitting unmute and nothing's happening.
Okay. Well,
Okay, are we good now?
yes, we're good. Sorry.
So it's, you know, it's hard to know. It's different for everybody. We do have a lot of our peers who, especially if they do not have anybody at home, they don't have family members, they don't have that connection, that are getting a little squirrely right now. Some are being able to maintain their recovery because there's so many options for meetings out there and connections and coaching. So it's kind of a toss-up. It's hard because those who we do meet in the hospital who need immediate help or need that detox or whatever they're looking for, if it's not available for them due to, like I said, nobody's accepting anyone or their insurance, or the same barriers that we really see all the time with the added crisis barriers, it's a little tough. We, a lot of our peers who alcohol tends to be an issue for them. They're not having a hard time finding alcohol right now. So, it has taken some people a little bit backwards because they're sequestered at home and all these, thought processes are in their head. But for some, it's just staying connected.
Yes.
We do see a lot of people joining into these meetings, and as I mentioned, doing what we would normally do face-to-face, a recovery coach session, doing it just like we're doing right now. I've been hosting a few. Our team is hosting them every day. So I guess it's like anything. It's hard to know. I mean, the worst part is that we just can't find immediate help, but that's always kind of been an issue. It's a lot harder right now if someone needs it immediately, but we're just trying to stay connected and show people where else they can be connected. If it's not in our area, there's a lot of places like Navigate Recovery in other counties. So we're trying to just hook people up with where they can just feel like they're not alone. That's really the main thing we're doing right now, is letting them know we're in this together.
Okay, would volunteers be of help to you? I don't know exactly in what ways they could help, but with connection virtually, is that a need that you guys may have?
You know what, let me spend some time thinking about how we could use our volunteers right now. A lot of what we're doing is just keeping our team busy with keeping up with, finding, like I said, things tend to change a little bit daily as far as who's accepting people and these resources that we're looking for. But I will definitely keep you posted as to if we could use any help. I really appreciate that question, actually.
Okay, well, thank you so much for all you guys do over there. Thank you. So next, we want to bring up Mr. Matt Davis, the Community Outreach Director from Obria. Are you there, sir?
I'm here. Me and Baby Yoda behind me. We're hanging out. So just some quick update stuff. We are open. We are seeing patients. Right. If you're not familiar with what we do, we provide medical pregnancy testing, pregnancy ultrasound, well woman care, and STD, STI testing and treatment for men and women. As people are getting stuck at home, right, they're finding some fun ways to pass the time, and they're coming in to get tested. We're actually seeing a lot more STD tests than normal as well. I am in touch with the Gwinnett Newton Rockdale Health County, the emergency healthcare, and I was on a call earlier with the Region D Healthcare Coalition, headed up by Grady, and they are all still trying to figure out what to do. Right, it's still a process, but we are open. We have a really good screening system and process. Our doors are staying locked, and when somebody comes up, they are met outside and they are screened for any potential symptoms. We have limited visitors, right, which is a little bit sad when you get a chance to do your first ultrasound and you're excited about that, and the father can't be in there with you just because of the way these limitations are having to work. So do be in prayer for our moms as they're coming in. We normally are open Monday to Friday. We're open Monday to Thursday right now, and Fridays are set aside for a couple of very important things. While we are sterilizing every day after every patient that comes in, we're wiping everything down or making sure our lobby stays good. On Fridays, we are doing a deep clean, and that is our staff sonographer and our executive director are going in and doing deep cleaning. And speaking to what Amy was talking about making sure we're limiting parents or potentially grandparents to stuff, that is the only day that for those who are participating in our Thrive program and have been able to earn the baby clothes and whatnot, and we've gotten really we're going to do a little bit extra during this time, especially in regards to diapers and wipes and whatnot. We're limiting that day to be the day that they come and can pick up supplies so that they're not being exposed to any potential patients. So we're making sure that we are taking care of everybody in a very powerful and good way. Just right, everybody out there, there is a lot of stuff on social media about this the COVID-19, and whew, so much of it is what's the polite way to say it? It's crap. You know, so please verify your sources. Just because your friend posted it does not mean it's true. There's been a lot of stuff going around, right? That, oh, I think, you know, what I had maybe last year, I think it was coronavirus, and I think it's been here longer than we realized. That's absolutely false. And to what Amanda was talking about, right? For those that are in recovery, this is a major time. We're also, you know, potentially seeing an uptick in domestic abuse and sex trafficking. So, you know, please keep those victims in your prayers as well. We are a place that tends to get domestic violence victims and sex trafficking victims because our services, pregnancy related, are no cost. So, right, there's the potential to get more people rescued if that's possible. I've done some homeless training out of Chicago, and that homeless shelter there has some positive patients, and they're still trying to figure that out. And here in our region, as people are maybe not being able to shelter in place at home because they're positive, they're still trying to get that figured out. There are hotels that are offering free stay for healthcare workers who maybe have been potentially exposed because of patients in their hospitals. So there's a lot of good going on. We are hoping to see the peak on April 24th and going down from that. So these next few weeks are going to be really critical. So everybody, please stay safe. You know, keep all the essential workers in your prayers, because that is huge, right? And that's not just, I mean, our healthcare providers are phenomenal, right? But we have people working at grocery stores, people, you know, picking up trash. These are all people that need to be in our prayers. We need to be covering them daily. So let's make sure we do that. If you need any information about us, right, our support website is supportomcg.org, or you can go to, you can just Google OBREA, www.obrea.org/Lawrenceville, I think is a website if somebody needs to make an appointment. I think that's about everything we've got. You know, y'all, we're well over 1 million cases worldwide. There's over a 5% mortality rate now. In Georgia, we're a little bit over 3%. So just to keep that in mind, we don't even, right, we're not going to know everybody that is positive of this, because not everybody's getting tested. But I did have a good friend of mine whose sister-in-law, who's 31 and good health out in California, had it. And she said for 5 days, it was the worst thing she's ever been through. So it's a very serious thing. One last thing, Lorenzo, this has nothing to do with me or OBREA. There's a really good article on CNN about people of color, specifically Black men, being worried about wearing masks in public because of the perceived bias already against them. So if you see someone out not wearing a mask and they are a person of color, please don't look down on judgment in them. They are already facing a lot of societal judgment as it comes, and they are just doing their best to make sure that they're not looked at as being that scary person. So, and if they are wearing a mask, please don't prejudge them as thinking, ooh, what's that person doing? Why do they got that mask on? Let's keep that in mind too, and be praying for people that are already vulnerable and that are in a more vulnerable state now. So thank you.
Thank you so much. Thank you, Matt. I appreciate you. So I understand now that we have Danielle on from Viewpoint. Hey, how are you?
Hey, how are you, Lorenzo? Good. I apologize for my tardiness. I just got done with Veterans Court. We are still running our courts virtually. So we just finished up Veterans Court. So I appreciate you guys inviting me and having me speak. If you all don't know who I am, I'm Danielle Mayberry. I'm a licensed clinical social worker. I'm the director of the Community Courts Program for Mental Health and Veterans and Community Support Services at Viewpoint Health. And Viewpoint Health is our community service board that primarily works and serves individuals in Gwinnett, Rockdale, and Newton counties for individuals that need behavioral health services. So, right now, given our circumstances and our new normal that we live in right now, just as an update on what Viewpoint Health is doing, we of course are trying to support and stay the safety net for all individuals in need of behavioral health services, but also keep our staff safe and our clients safe. So most of all of our services have moved to telehealth. So anybody can call our main number, and that main number is 678-209-2411. That's our access number. Anybody can call that that's trying to access services, and then someone from our access department will get you connected and scheduled to talk to a counselor, a therapist via telehealth, via Zoom, just like what we're doing here. Since Zoom is HIPAA compliant, we have licenses for that. So we are still providing services. We are providing individual counseling through telehealth, psychiatry services through telehealth. Our courts are being run virtually as well here in Gwinnett County, so we're doing that and providing groups for our court clients. We're also doing just for the community-based programs that I work with, we are trying to obviously keep our distance just for social distancing guidelines and things like that, but are meeting with our clients in the community if needed, if requested, if it's an emergency situation. We're gonna definitely come and see them as long as it's not gonna put anybody at risk, but we're mostly doing telephonic follow-ups with all of our individuals on our caseloads. Our CSUs, our crisis stabilization unit here in Gwinnett right now is not taking admissions. We are kind of working on being more creative to keep people safe at home, but also safe. If it needs to, there needs to be an admission that can be discussed through that access department. But right now we're kind of in a place maybe next week that we can start taking admissions again, but we want to try to be creative with it so that we can keep everybody safe. So yeah, that's what we're doing. That's what we're trying to do. We've been very creative in trying to still support all the individuals that need those behavioral health services. So that would include mental health and substance use services. And you can call that main number and we can make sure you get connected.
Wow, thank you so much. I appreciate that. You guys are doing awesome. And thank you for being able to join us. I know you said that you may or may not be able to.
Yeah, no, I appreciate you guys inviting me. Like I said, we just finished up. I have been in court since about 9 o'clock. We do mental health and veterans court back to back. And we finally just finished up veterans court because we want to keep our participants safe as well, but we still want to see them and support them. So we've been doing court and staffing via Zoom, but we're able to see the clients, check in with them, and it's really great. I'm glad we have this technology to do this.
Absolutely. Thank you so much for everything.
No problem.
All right, next we are going to move to Norma. Norma, are you there?
Yes, I'm here. Can you hear me?
I can. Go right ahead.
Thank you so much for letting us be part of your luncheon. My name is Norma de la Garza. I'm a bilingual paralegal, and I work at the Gwinnett office. Legal Aid is a nonprofit organization who serves people in Fulton, Cobb, Gwinnett, DeKalb, and Clayton counties, only the Metro Atlanta. We provide free legal advice and representations in the following areas: family, juvenile, probate, consumer, education, employment, public benefits, and housing. This is a free services. But the good thing right now, even if the offices are closed to the public, we're still working from home. Everybody's on board working from home. But the new thing is Legal Aid is taking online intake applications. That is wonderful for everybody. They just need to go to the atlantalegal.org website, click on online intake applications. They can fill out the forms and somebody gonna return the phone calls, okay? The Gwinnett main office number is 678-376-4545. And my direct number for the Spanish-speaking clients who doesn't speak English is 678-514-4832. If people don't have access to computer to apply for food stamps, they can give me a call, okay? I can help it through the website to apply. That's what I'm doing right now, is one of the main things we are doing. And if our intake hours in Gwinnett office is Tuesday, Wednesday, and Thursdays, 9 a.m. Please feel free to call us back, share our information. I will write this information on our chat. And I'm glad that everybody's still working, even if it's virtual. I know it's taking more time, but I'm glad we can help needy people.
Amen. Thank you so much, Ms. Norma, for everything that you're doing. Thank you. So
My
next,
pleasure. Thank you.
yes. So we're gonna move on. Next, we have Mr. Brian DiNapoli with DCA. How you doing, my friend?
Doing well, Lorenzo. Thank you all. Thank you, Brendan. Thank you again, Lorenzo, and I hope everyone's safe and well and your families. This is Brian DiNapoli with the Department of Community Affairs. I work with the RPH program, or the Reentry Partnership Housing Program. And in a nutshell, you may have heard me talk about it before. It provides housing for people coming out of jail or prison, or they've been remanded to an accountability court if they don't have a housing plan or they're homeless. This is a great program. It provides the housing for up to 6 months, and we're seeking new providers. We have the provider application cycles twice per year, spring and the fall, and we're in the middle of our spring cycle. We should have been having workshops this month, but obviously they're going to be postponed. So we'll keep you posted when they'll be held. So we have about 70 agencies that are interested in providing this housing this cycle. The great news is we've gone up on the amount that we're reimbursing our agency. We went from 600 now to 750 per individual per month. And for mental health level 3, which is a higher level, that's gone from 675 to 850. So we're very excited about that. So this is some great news, and there's going to be a huge need for this type of housing, obviously. And thank you for your time. And just wanted to say our greatest setback is going to turn into our biggest comeback. And thank you all, and be well.
Amen. Thank you so much, Brian. Appreciate you. So lastly, I want to bring up the Asian American Advocacy Fund candidate form. So Mr. Trent, are you on?
Yes, I'm here.
Okay, go right ahead.
Hi, my name is Vin. I'm the program coordinator down at Asian American Advocacy Fund. What we mainly do is voter and political awareness and advocacy. And so tonight we will be having a political criminal and immigrant justice rights candidate forum. It'll be hosted Facebook Live at 6:30 p.m. So be sure to check out our page to tune in. We will be asking candidates questions on policies and advocacy matters so the general public is able to see how they will tackle those issues. The candidates there will be the DA candidates Patsy Gatson and Wesley Person, sheriff candidates Floyd Scott, Ben Hayes, Curtis Clemens, and Kibo Taylor. So if you would like to know more information about this forum, you can check it out at our website, asianamericanadvocacyfund.com.
Amen. Thank you. Thank you so much for that. And thank you everyone for being on today. We know that this is new for everyone. This has been unusual, but thanks to all of you, it has been a success. And just to be true to our time, we have probably about 3 minutes left. We just want to remind you that our next meeting, as it says on the screen, is going to be May 5th. So mark your calendars for May 5th, and then it will also be from noon to 1. And again,
I think Bob Harsh had a question.
Oh, I'm sorry.
Let me unmute Bob Harsh. Go ahead, Bob.
I have 2 questions. Is my microphone on?
It is.
It is.
Okay. 2 questions. One was way back with the Salvation Army with Antoinette. I'm working with a lady that is trying to find a job, and she's in work release, and she's having a terrible time on a job. In work release, I don't know that she can attend any kind of virtual meetings of anything, and maybe it's for anybody else that wants to answer, but she has no transportation, so I've had to go out or find somebody else to go out and pick her up from the bus routes and take her back to work release. And I wonder if you had any answers to where else to look for a job.
Bob, let me do some research on that. We have a work development department that we work with. So let me get with the director at that department and see if she has any resources, and then I can get back with you. So I'm going to give you my cell phone number, and that's,
Okay.
you ready? It's 404
404
989 5359.
Now, related to this, this is a suggestion for GGRA, the brass of GGRA. You can probably imagine the hardship people have in just being out of jail and trying to find a job. Well, we're in a time when there's a lot of people out of work. And so they'll be the last pick, but yet they still have to pay to stay. I don't know if everybody realizes it. You have to pay to stay at work release. And if you don't get a job, they'll send you back to jail. And so my suggestion is GGRA try to petition whoever at the jail, the jail system, I guess, to forego anybody that can't find a job, forego the fees for a month at a time or something like that. But it puts them in a place that they just can't find a way out other than going back to jail, and they don't want to do that. Do you understand my suggestion?
Absolutely. And Bob, I agree with you. Everybody on all levels, all across the board are having to look at how they're trying to recoup bills and things that may be owed to them, and that we all have to be compassionate. That's a good suggestion. That's something that we definitely can look into.
Thank you. I have a second question too.
All right, go right
I
ahead.
have another friend that I'm trying to help, but he has to go to DUI school. And he's trying to find work. He's a carpenter. He has no transportation, so he has to get to places the way he can. He's been in prison, so he doesn't want to go back to prison. But he has to go to DUI school. Does anybody know if they're going to offer something like that online, that they can take care of that requirement so they can get their driver's license?
I don't know of anything myself. Maybe someone may know, and we can, talk about that offline. I would say for them to actually go on to their site and see if they're offering any type of relief in that manner.
Okay.
I believe that Lee also, for your woman that you mentioned previously, Lee Robbins has an organization now that he can help. Lee, are you on?
Yes, thank you, Brendan, Lorenzo, and the crew here. Appreciate you guys having this meeting. I know it's quite difficult for everybody to be at home arrest right now. We all at home arrest, but praise God. But listen here, Bob, I do have an opportunity for the young lady or anybody who would like to go online, and we've put the website address there, safestaffinginc.com, safestaffinginc.com for job opportunities. Our career coach will respond in 24, 48 hours and get all the information we need to try to make a connection to an employee that can help them. And also with the transportation issue, the individual who needed the transportation can go to uplifts.org, and can set up an individual account if they're not under a chapter. Chapters usually sponsor our individuals to get free rides, but if they cannot set up an individual account, they can set up one there for us, and we can do the dispatching. If loved ones wanted to help with that funding process, they can do that as well. And then we also have our churches will, have an account that can sponsor, once the money is gone, it's gone, but when it's there, it's there. So
he doesn't have any money.
I understand, but we do have, like I said, some of the churches, even their families, or someone can donate to that account if they're not under the chapter. Now, if they can, we can also connect them to GRIP and see if GRIP will help to sponsor that individual, since they are at the Gwinnett, they're not at the Gwinnett jail, but they are in the same area, right? So we can probably help.
So she needs to register at uplift.org.
She needs to register at Safe Staffing, Inc.
Okay, for the job.
It's on the website. And then if the individual needs transportation, her or the other guy needs transportation, can go to uplifts.org. The career coach will be able to help them with that, navigate them through the resources. So first step is just go to the staffing company, and then we will navigate them through the process.
Thank you.
Thank you.
All right, thank you, Lee. Is there anyone else that want to say one thing, maybe about 1 minute before we close out, because we're right at 1 o'clock?
I don't see any other hands raised.
Okay, great. So guys, again, thank you for coming on, and thank you so much for all that you do. And before you guys go, allow me to say a prayer over everyone and their family. All right, could we go to God in prayer?
Yes.
Father God, because we live under the shelter of you, the Most High, we will find rest in the shadow of you, Almighty. This we declare about you, Lord. You alone are our refuge, our place of safety. You are our God, and we trust you. For you will rescue us from every trap and protect us from every deadly disease. You will cover us with your feathers. You will shelter us with your wings. Your faithful promises are our armor and protection. We will not be afraid of the terrors by the night, nor the arrow that flies in the day. We will not dread the disease or virus that stalks in darkness, nor the disaster that strikes at midday. Though 1,000 fall at our sides, though 10,000 are dying around us, these evils will not touch us. We will open our eyes and see how the wicked are punished, because we have made you our Lord, our refuge, made the Most High our shelter. No evil will conquer us. No plague, including the coronavirus, will come near our home, for he will order his angels to protect us wherever we go. They will hold us up with their hands so we won't even hurt our foot on a stone. We will trample upon lions and cobras. We will crush fierce lions and serpents under our feet. The Lord says, I will rescue those who love me. I will protect those who trust in my name. When they call on me, I will answer. I will be with them in trouble. I will rescue and honor them. I will reward them with a long life and give them my salvation. In Jesus' name, and everyone says, amen. Thank you, guys. Thank you. Have a wonderful, wonderful weekend, and we'll see you again.